A lot of people don't have symptoms when they have an inguinal hernia, especially if it's small and is not complicated. Maybe a lot of times patients come to see a doctor because they start seeing a little swelling, a little lump coming at the level of a groin, and then they're inquiring about what is this lump. Inguinal hernia becomes symptomatic normally if they become very large, and then they can cause pain, discomfort, or if they're getting complicated. When inguinal hernia tends to become bigger, they can get strangulated or incarcerated, and especially if it's inside, there is loop of bowels that can cause a lot of pain, nausea, vomiting, but that is normally surgical emergencies, and a lot of time when these symptoms are presenting, patients are going to the emergency department for urgent assessment. The great majority of the time, patient goes to the GP because notice a little swelling on the groin. The diagnosis is clinical. So what we look for when a patient comes and say, I have a lump, is for a hole on the abdominal wall. The abdominal wall is made by different layers. The one that we see on the outside is basically our skin, but underneath our skin and the subcutaneous tissue, there is a layer made by fascia and muscles. When there is a hole on the fascia and on the muscles, that is where a hernia can come through. So when we do a clinical examination, we go and look for this hole, to fill this hole. There are times where it's not obvious if we are dealing with an inguinal hernia, and therefore normally we request an ultrasound scan. In some specific situation, we maybe need a CT scan to better assess the size and the site of a hernia. An inguinal hernia can be something which is acquired. People can be born with a defect on the abdominal wall, and this little hole, when there is a lot of pressure put on the muscle, tends to become larger, and the contents of the abdomen tends to come through the hole, and that is what we call a hernia. It's not unusual that hernias are more likely to appear on people who put a lot of pressure on the abdominal wall. So people who, for example, exercise a lot and do a lot of heavy lifting, either at the gym or because they have a physical manual job. The treatment for a hernia, in general, an inguinal hernia, are always surgical. So if a hernia is very small, doesn't cause any symptoms, it can be left without planning for surgery, but eventually only the surgical treatment can close the hole and stop the hernia to grow bigger. So the surgery are normally considered, especially for small, medium-sized inguinal hernia, always are considered minor surgical procedure. are normally carried on under general anesthetic. The great majority of the time, patients is able to go home on the same day after this type of procedure. And normally I always suggest that unless there is some major medical contraindications, always better to treat a hernia when it's smaller, because the surgery will be less invasive and more straightforward, but let it to grow bigger, where is when it can become complicated and then add complexity to the surgical procedure. Unfortunately, there is little in terms of prevention. So as I said before, having these point of weaknesses on our abdomen is a congenital, let's call it a congenital condition. So, and especially if someone does heavy lifting for sports or for work, it's more likely that hernias can come through. Now, a hernia, inguinal hernia, is a benign condition. Patients do not have to have an inguinal hernia treated, and they do not have to have a surgery. There are a lot of patients who are living with a hernia for a very long period of time. However, if a hernia tends to become bigger, can get complicated. The content of a hernia is normally bowel. If a hernia becomes big, the bowel can twist, and that can cause occlusion, can cause patients to become very unwell and needing emergency surgery, with procedure that become much more complex than a simple repair of a small hernia.